Cassidy Abdomen. Hi, my name is Cassidy Abdomen. I'm a nurse practitioner and I'm going to be performing an abdominal assessment on you today. First thing we're going to do is I'm just going to inspect your abdomen. So we're going to look and see that your abdomen is nice and symmetrical, which is good. Your umbilicus is in the midline position. I don't see any bulges, inflammation at all, which is also good and normal. As far as your skin, it is nice and pink. I don't see any scars or lesions or striae or dilated veins, and no rashes are seen as well. Your abdominal contour is nice and flat. I don't see any peristalsis or aortic pulsations. Next thing I'm going to do is listen to your bowel sounds. So we'll listen in all 4 quadrants. Perfect. Your bowel sounds are normal active in all 4 quadrants. Next thing I'm going to do is listen for friction rubs. I'm going to listen over your spleen and your liver, and it would be normal to not hear any friction rubs. Okay, good. And no friction rubs were heard. Next, I'm going to listen for the presence of roots. So I'm going to listen over your aortic area and then 3 sets of arteries, your renal, iliac, and then femoral arteries. So use this side of my stethoscope here. Okay, perfect. And no bruits were heard. And then last thing I'm listening for is for venous hums. And listen over your epigastric area and then your umbilicus. Perfect. And no venous hums were heard, which is normal. Okay. Moving on, we're going to do percussion. So I'm going to percuss in 9 areas of your belly and just check for tympani. Perfect. And tympani was heard in all regions. And then I am going to percuss your liver, and I'm going to measure your liver, like the distance between what I hear. So we're gonna start here, and I'm gonna mark it with a pen here. And we'll go from the bottom. And then we'll measure it. And And that measures right about 10 centimeters, which is normal. Next thing I'm going to do is percuss your spleen. So I'm going to have you take a deep breath and hold it in, and I'm going to percuss right over on your spleen. All right? Okay, perfect. And resonance was heard there. Okay, next we're going to move on to palpation. First I'm going to take one hand and just you to palpate on your stomach, and you just tell me if you have any tenderness. Okay, perfect. And I didn't feel any hernias, bulges, or masses, and your abdomen was nice and soft. Okay, next I'm going to do a deeper palpation using both of my hands. And just tell me if there's any tenderness. Okay, perfect. And I also didn't feel any resistance, no masses were palpated, and your abdomen was soft. Next, I'm going to palpate the edge of your liver. So I'm going to have you take a nice deep breath in, and then I'm just going to feel right over in here. Please take a breath. All right, perfect. And did you feel any tenderness there? Okay. Your the edge of your liver was nice and soft and smooth, so that was good. Next I'm going to palpate your spleen. So I'm also gonna have you take a deep breath in, and I'm just gonna press in on your side and just tell me if there's any tenderness. Okay, perfect. And I did not palpate the tip of your spleen, which is normal. Okay, next I'm going to attempt to palpate your kidneys. So I'm just going to reach around in your back and just press down on your stomach. Let's see if I can do that. Okay. And your kidneys were not palpated. Okay, and next can I have you set up for this? I'm just going to test for CVA tenderness and see if there's any tenderness where your kidneys are. Any tenderness there? Okay, perfect. You can lay back down. And then next I'm going to check for ascites. So you can just leave your hands at your side. I'm going to go from like a central area and just move outward and percuss and just see if what I can. Okay. Okay, perfect. I heard tympani in all areas, no dullness was heard, so it's good to sign that you do not have ascites. Next, we're going to check these signs for appendicitis. So I'm going to have you take in a deep breath, and then I'm going to press in on your stomach, and just tell me if you have any tenderness. Okay, so that is the rolling sign, and that was negative. Next, we're going to check the psoas sign. So I'm going to have you just uncross your legs, and I'm going to put my hand just above your right knee, and I want you to just push up with your leg. Okay, good. And was there any pain during the resistance? Okay. Next thing I'm going to do is I'm going to bend your right knee, and I'm going to move your hip. Rotate your hip internally and just tell me if there's any tenderness with that, and that is the arbitrator sign, and just see if you have any tenderness. So I'll just bend your knee here. Tenderness?
No.
Okay. Perfect. And the arbitrator sign was also negative. Last thing we're going to do is check for cholecystitis. So this is the Murphy sign. So I'm going to palpate the edge of your liver and I'll have you take a deep breath. And then just let me know if any sharp pain was noted. Okay? Take a deep breath. Okay. All right. And no sharp pain was noted and your respirations continued as normal. And that concludes our assessment.